Hello and welcome. NPF's advocacy team and its volunteer advocates engage our elected officials and policymakers on the issues that matter most to our community. As an advocate, you will have the opportunity to engage in advocacy efforts at many different levels of government. This segment will give you an overview of the state and federal government processes to assist you in your advocacy efforts for psoriatic disease patients. As you may remember from your high school civics class, our government is made up of three branches: the legislative, the executive, and the judicial. This also applies at the state level, with the governor as the head of the executive branch rather than the president. At NPF, we engage in advocacy efforts with the legislative and the executive branches, both at the state and national level. This leads to a discussion of federalism, the differences between the state government and the federal government. Federalism refers to how the United States divides governmental power. Some powers are exclusive to the federal government and apply to the nation as a whole. There are also exclusive powers that are for just the state governments, and those powers are applied to the individual state through each state's constitution and laws. There are also powers that are held concurrently between the federal government and the state government. Here at NPF, we advocate for changes in healthcare policy at both the federal level and also at the state level. Since we advocate at both the federal and state level, it is important to understand which government regulates each type of healthcare and health insurance. At the national level, the federal government regulates ERISA plans, also known as employer-sponsored health insurance plans, large group insurance plans, Medicare, and Medicaid. At the state level, state government regulates state employee plans, individual insurance, small group insurance, and Medicaid. You will notice that Medicaid is listed under both the federal and state. This is because Medicaid is concurrently regulated by both the federal government and the state government. Now we will move on to talk about the legislative process, both at the federal and at the state level. At its most simplistic level, the federal legislative process starts with an idea. That idea is then drafted into a bill and introduced in either the House or the Senate. The bill works through the legislative process, and if the bill is supported by both chambers, it will be sent to the president. If the bill is signed by the president, the bill will become law. During this process, bills are assigned to committees and hearings are held. The legislative process can sometimes seem a bit intimidating, but as an advocate, you will learn about the legislative process and how your experiences can shape public policy. The NPF advocacy team will help you by providing support and educational tools. You will be an advocacy pro in no time. Each state legislature is governed by its constitution and laws passed by the legislature. This means that no state legislative process is alike. However, the legislative process is similar in that a bill starts with an idea, must be introduced by a legislator, go through a committee process, and have at least majority support before the bill is sent to the governor for approval. Once a bill becomes a law, it is up to the executive branch to implement and enforce the law. Both the president and governor use agencies to implement and enforce the laws that are passed. Sometimes, legislation will require that a rule be established to ensure the law will be followed. A rule typically gives more detail about how the law will be implemented and enforced. This process can be a quick process, or it can take several years. The NPF advocacy team and volunteer advocates engage agencies to inform them how the rule may affect our population and provide recommendations on how the rule should be drafted. Advocating after a law has been passed to ensure that it will be followed is an extremely important part of the advocacy process. Now that you know more about the legislative and executive processes, you are well on your way to be a champion for patients with psoriatic disease. Remember, state and federal governments regulate different types of healthcare and health insurance. If you're advocating at the national level, you could be asking for policy changes regarding ERISA plans, large group insurance plans, Medicare, or Medicaid. If you're advocating at the state level, you could be asking for policy changes regarding state employee plans, individual insurance, small group insurance, and Medicaid. Thank you for watching. If you have questions or want to learn more, check out the other resources on our website or email us at action@psoriasis.org.